Did you know that in the US, a stroke occurs every 40 seconds? It is estimated that 1 in 5 people in the US will have a stroke in their lifetime, and 1 in 4 survivors will have a second stroke. As a result, stroke happens to be the leading cause of serious long-term disability in the US. Studies have noted that each year 10 to 15% of the approximately 800,000 people in the US who have strokes are between the ages of 18 and 45. This increase is thought to be due to increased sedentary lifestyles, obesity, high blood pressure, diabetes, and drug use. The good news is that as much as 80% of strokes can be prevented through healthy lifestyle choices. So what exactly is a stroke? Some folks might refer to them as a brain attack, similar in mechanism to a heart attack. There are 2 distinct types of strokes, the most common being an ischemic stroke, in which a blood vessel in the brain becomes blocked due to a clot forming elsewhere in the body or narrowing of the blood vessels in the brain. When this occurs, a portion of the brain is deprived of oxygen and becomes damaged. It is estimated that every minute the brain is deprived of oxygen, 2 million brain cells are lost. A transient ischemic attack, otherwise known as a TIA, is considered a warning stroke and consists of transient neurological symptoms that resolve without any tissue injury. Even though the symptoms resolve on their own, this is considered a medical emergency, and prompt evaluation and treatment can reduce the risk of future stroke or TIA by at least 80%. The lesser common stroke is referred to as a hemorrhagic stroke, in which there is a bleed in the brain. This might result from ruptured small blood vessels, arteriovenous malformations, or rupture of an outpouching of a blood vessel called an aneurysm. The #1 risk factor for both types of stroke is high blood pressure. Other common causes include high cholesterol, diabetes, atrial fibrillation, and sleep apnea. In addition to managing risk factors, the most important thing to reduce disability from stroke is to identify the symptoms quickly and get help. For this, we use the mnemonic B FAST. B stands for balance. Watch out for a sudden loss of balance or coordination. E stands for eyes. Note any vision loss in one or both eyes or double vision. F stands for face. Watch out for drooping on one side of the face. A stands for arms. Note any sudden weakness in an arm or leg. S stands for speech. Note any slurred speech or difficulty speaking or understanding words. T stands for time. Call 911 quickly if someone is experiencing any of these symptoms. As we say on the stroke service, time is brain. Other common signs of stroke include sudden severe headache with no known cause, sudden numbness of face, arm, or leg, and sudden loss of hearing on one side, or swallowing difficulties. Things that will be very important to document are when the person was last seen at their normal. You want to get to the hospital within a 3-hour window of symptom onset to increase likelihood of receiving life-saving medications and procedures. An ambulance will transport you to the closest stroke-certified hospital, and EMTs will do a stroke assessment so that they can communicate with the hospital team and prepare them for your arrival. You will bypass the ER waiting room and save time. Time is of the utmost importance. 2/3 of stroke survivors are disabled due to delayed care. Don't wait, just go. Once at the hospital, you might receive a thrombolytic such as TPA or TNK. These are often referred to as clot-busting medications. When given within 4.5 hours of symptom onset, these medications can restore blood flow to the affected area and decrease damage to the brain. Depending on the size of the stroke and the vessel involved, a thrombectomy may be performed as well to remove the blood clot from the vessel.
While suffering from a stroke can be a difficult life transition and present obstacles to daily routines, there is reason for hope. A team of specialized professionals can guide your recovery to regain function, independence, and purpose. As the brain heals, it relearns how to do basic activities and can rewire itself to learn new tasks. A good healthcare team and strong support can make a major impact for people of all types and severity of stroke return to a meaningful life. Stroke Awareness Oregon can help you connect to the right resources to make your road to recovery fulfilling and purposeful.
Recovery from stroke is going to be some of the toughest work you've ever done in your life, and not doing it alone is really important. Stroke Awareness Oregon was founded by a stroke warrior and local medical doctor to bring awareness to Oregon communities of the risks and signs of stroke, how to spot them, and what to do if you or someone you know is showing signs of a stroke. We do this through our Be Fast card distribution, Stroke 101 community presentations, and Stroke Hero training, which is an early prevention tool for 4th grade students, encouraging healthy lifestyle choices at an early age. Because as you've learned, strokes are 80% preventable. We at Stroke Awareness Oregon are here to help support you in your recovery journey back to a better quality of life after stroke.